All right, good afternoon, everybody. Thank you so much for joining us for this ninth and final session of our Lunch and Learn series. Today, we are going to talk about adjusted income, and we have a case study that's going to follow along with that. If you joined us last week, then you are kind of prepared for how the case study is going to go. If you did not join us last week, never fear, we're going to work a tenant file, a relatively simple one, and then we're going to adjust their income and determine their tenant rent. I have with me today Amy Hammond in the questions box, and then she will also put resources in the chat box. I also have with us Justin Merrill, who is going to jump in if there's 811 information that differs from what's in the presentation. My name is Kara Polai, and I will be the presenter today. This is being recorded and will be posted to the department's YouTube channel. That may take a couple of days, and then I will begin working on getting the entire Lunch and Learn series posted to our presentations page, along with all of the handouts that go with each item. That is a cumbersome project for our IT folks and our web liaisons, so bear with us. It might take us a little bit to get that done, but we will get that posted and be able to be used as a resource for you guys. If you can hear me, give me a thumbs up. If you can see my mouth moving, but you cannot hear me, please log out, log back in, see if that doesn't fix it, or you can call in using the call-in number. If you did not download the handouts, I'm seeing lots of thumbs up. That's great. If you did not download the handouts that were emailed to you, you can find them at the top of your go-to toolbar. It looks like a sheet of paper with a paper clip. That's where all the handouts are going to be. The questions box is right there as well. Then there's the chat box where Amy will put resources. If you need closed captioning, please use the go-to closed captioning button. It should be at the bottom of your go-to window, like it is on TV with the little CC in the square. I will have some polls to launch today. Those polls will cover up your screen. Unfortunately, we have not found another way around that. But right now, you should have in your email or in that handouts button the polls and calculation slides that you can print or keep open on a side screen to use as a resource. To kick off our webinar, I want to find out who's with us today. So I'm going to launch a poll. And this is an easy one. Everybody should get the answer right. It's going to tell us who's with us today. Just going to let that run for a second. Lots of folks participating in the poll. I like it. Thank you. All right, in the interest of time, I'm going to go ahead and close this. It looks like a lot of folks are on-site staff, compliance teams, a handful of management company and ownership folks as well. It's not going to change how the information is presented or received. It just helps us to know who's attending our trainings. So as always, we've got our housekeeping slides. We do have our current mailing address there, which is the P.O. Box. And then the physical address on East 11th Street if you want to see where the magic happens. Our website is, however, going to be the greatest wealth of information for you. You can visit that. There's a search box in the top right corner that works really well. I use it pretty regularly to find things that I can't find easily. Or you can save some of the links that are in the links that Amy's putting in the chat that will be able to better help you locate these compliance resources. This webinar is going to be geared for multifamily compliance. So if you are single family or tenant-based rental assistance or a program outside of what the department does, you may want to confirm with your program administrator that what we've trained is how they would want you to process the applications that you're looking at. We've got our main department phone number and toll-free number in Texas. If you need to, or if a tenant wants our phone number, that's there. They should be getting that tenant rights and resources guide, which has that in there as well. But that's a good place to start. If you're not sure who you need to talk to, they can forward those voicemails or calls out to the applicable department. So this is going to run from noon until about 1:30, and some of that end time depends on how many questions you guys ask. If the topics are well understood and there are no questions, we might end a little bit before that, but if there's lots of questions, we'll probably go right up to the 1:30 mark. I'm going to present the training and then allow for questions after each chunk. Certificates are not provided today. You will get an email that says, thank you for attending our Lunch and Learn webinar. However, you will not get a certificate. If you need a certificate for income determination, you can either take one of those classes through the Texas Apartment Association, or you can attend the September 3rd offering of that we're going to have, which is going to be the full class as an all-day webinar, and that one will have a certificate. I would encourage you that for this hour and a half, that you put it out of office or close your email, shut your phone down, whatever you need to do to help avoid distractions during the webinar. We want you to get the most out of it that you can. However, we understand that you guys are all busy and you're running assets and are not able to necessarily just completely shut down for an hour and a half. Please put any questions in the questions box. I don't believe you guys can chat in the chat box, but you can get the resources that Amy puts in there. Some resources and definitions. First and foremost is the HUD Handbook 4350.3, which is how we calculate income and who counts as a household member. So all of the income determination webinars that we have done have been based on that information, as well as the HOTMA changes that went into effect for most department programs on January 1st, 2024. In the multifamily group, the only program that did not go into effect on 1/1/2024 was the 811 program, and that is going to go into effect in January of 2026. We also use the technical guide for determining income and allowances for the home program. And then 24 CFR 5.609 outlines annual income and what's excluded from that. If it is not listed as an excluded income, then it is to be included as income. The Texas Administrative Code has a new home. So if you had our old website bookmarked, you are going to want to get this new link that's there at the bottom of your screen and make sure that you bookmark the new information. It is laid out a little bit differently. You can now see the whole rule when you're looking at any specific chunk of the bigger rule. And that's going to help you be able to use that Control F or the find function on your internet browser, or if you PDF those. Some multifamily compliance resources. We have all of our forms available. We have our manuals and rules listed there. And while we don't have a manual, we try to write our compliance rules as if they were a manual that you could kind of walk through. Excuse me. The income and rent limits are posted there, and there's an income and rent tool that you can use. Multifamily compliance training and presentations are available at those two links. That presentation site is going to be a wealth of information for you. And if you have new folks start, or you have somebody that needs a refresher, that's a great place to go and kind of pick and choose which trainings. Most of those are, just an hour and a half. Some of them are a little bit longer. And then a couple of them are day-long trainings, but they are a great resource for you. And then our compliance division staff is there towards the bottom. And that is going to have all of the monitors, physical inspectors listed. So if you're not sure, if you forget how to spell my last name, or you can't remember if Amy is spelled with a Y or an IE, you can visit that compliance division staff list and find the appropriate monitor and email or call them from there. I think most of us would request that you email us, simply because we do go out in the field, and like right now I'm doing this webinar. So if you were to call me, if you left a message, great, I can call you back, but a lot of folks don't, is what I'm learning. And if you send me an email, I can always give you a call as soon as I'm able to do so. Amy says never an IE, always a Y. And that's like me, always a C, never a K. But we do have a Kara with a K, and she's pretty great. So don't sleep on that either. And then the Home American Rescue Plan link down there at the bottom, and that is because the file we're going to walk through is intended to be a home ARP tenant file, because that's one of the programs we have where you might have to do adjusted income from the very beginning. And for those of you that are with us thinking, man, I don't have to do adjusted income, why did I decide to spend my lunch here? Stay with us, learn the information. It's going to be beneficial. The home funding is being used for some gap funding for different things. There are different programs that may get added onto your property that may require you know how to do adjusted income. And if nothing else, it's just a feather in your cap where you can tell your bosses, your compliance folks, your owners, hey, I know how that works. And it's just one more thing that you're above the par on. So for income definitions, this is all amounts, monetary or not, that are received by the household or by the family members in the household. Unearned income does count for minors. And then it's also some sources of anticipated income. If they tell you they're looking for a job, but they don't have one yet, that's not anticipated income. Yes, we want them to find gainful employment, but they also don't have that set, so you can't guess what their employment is. But if they say, hey, I'm moving to your property, here's my offer letter from wherever I'm going to go work, that is anticipated income that you would include. Annual income includes everything that's not specifically excluded by regulation, which is that 24 CFR 5.609. And for a list of some additional income inclusions and exclusions, you can refer to that HUD notice that's linked there. And we're going to talk about that a lot. That's where the HOTMA guidance really got laid out in a digestible way. And we are all able to really kind of dig into that and really discern what HOTMA essentially said. Assets are items of value that may be turned into cash, but they don't have to be cashed out. Not all items of value are considered an asset. Items are not. Items that are excluded from income may or may not count as an asset, and certain assets have excluded incomes and are excluded assets as well. And for a list of that, you can refer to that HUD notice. When I talk about the household, that's everybody that might live in the group. That's including live-in aides and foster persons. But the family are the people that are included for purposes of eligibility. So a foster person or a live-in aide would not be considered part of the family when we're talking about eligibility. And that's further outlined on this chart. So for deductions and adjusted income, we're not looking at the live-in aide or the foster persons. We're looking at the head, spouse, co-head, other adults, dependents, and full-time students that are 18 or older. That's who we're looking at for purposes of eligibility. In week 1, it doesn't have that in there. So in week 1, we talked about the screening process and the interview process and kind of what to do for that. The next 3 weeks, we talked about income, earned income, unearned income, and special circumstances. And then we spent 3 weeks talking about assets. We talked about common assets, uncommon assets, and then we talked about real property and disposed of assets. Last week, we did a case study with a household that's similar to what you guys might see on site. It didn't cover everything, but it did cover a lot of the things that you might see on a regular basis. And then this week, we're doing another case study with the adjusted income piece added in. So the first step is the application. And you've got to know what you're looking at. So with an application, if you have to adjust for income or do adjusted income for rent determination, you're going to want to have them complete a supplement to the application. This is not the supplement that you do for if you use the Texas Apartment Association forms, that long supplemental application. This is another type of supplemental application, and we're going to look at that here in just a second. You also have that saved in your handouts that are available in the go-to window. There are 5 available deductions. 3 are available to all households. 2 are only available to households that meet a certain age or disability threshold. The dependent deduction is going to correlate to the earned income counted for full-time students and adoption assistants, and these are all evaluated annually by HUD. The dependent deduction is for any household member that meets that criteria. The child care deduction now excludes foster children unless the household can evidence that the child care is paid for with the household's income and not foster care payments from the welfare agency. A reasonable attendant care and auxiliary apparatus deduction is available. This was formerly the disabled deduction. There is a 10% income test required for that, and we're going to talk a little bit more about that when we do the deduction. The elderly or disabled deduction went up from $400 to $525 with the HOTMA changes. And that is per household, that is not per person. And the household has to meet certain criteria that we're going to talk about when we talk about that deduction. Unreimbursed health and medical care expenses only are available to those elderly or disabled households. And if they haven't already met that 10% deduction from the attendant care deduction, they would have to then meet that with this attendant health care or unreimbursed health and medical care expenses deduction. And we're going to look at those two things in more detail. The family has to be screened for deductions, so a supplement to the intake application must be used. We have one on our website that you can use if you would like to. This is a flow chart with those 5 deductions in case you needed something that you could print and jog your memory as to who gets it and who doesn't. The 3 deductions at the beginning, the dependent, the child care, the auxiliary care or attendant care and auxiliary apparatus deductions are applicable to any household under your program. The 2 deductions that are only for elderly, meaning 62 and up or disabled households, are going to be the elderly or disabled household deduction and then the health and medical care deduction for all members of the household. So we've gone through the application, we've documented their income, we've annualized it, we've adjusted, or we're going to adjust today, and we're going to complete the certification. But for our case study, we first have to look at the application. So we've got William and Mary Russell with 1 dependent, Jerome. Were any members of the household full-time students within the last calendar year? Yes, Jerome. Anybody as a foster person? No. Anybody as a live-in attendant? No. Nobody's temporarily absent, and nobody's joining the household. We can see here that William and Mary are receiving income, so we know that we're going to have to expect to see screening tools for those. We can see that Jerome is a minor and has no income, so we think we're going to move forward without having to worry too terribly much about that. The next piece is the employment. We can see here that our head of household has employment, and then our co-head has Social Security, and they've given us some more information here. So Mary works, and she's given us all that information so we can reach out to that employer or we can get pay stubs. And then we've got some asset information here, and because this is home ARP, we're going to verify all of those assets. You normally, depending on what your program is, you may or may not have to verify those, but the home program does require those be verified. So we've got our checking account, a secondary checking account, a savings account, a Cash App account, and then it looks like there's a Chime account as well. Looks like there might have been a house, and they said it was foreclosed on in 2024. So we know that that's not going to count as a disposed of asset. Nobody owns any property now, so that's not going to be a problem. And then the household received a tax refund in the last 12 months. So they're telling us that $3,600 was the amount they received. So if their net family assets is not going to equal 0, then we would need to deduct that tax return. And we're going to look at that as well. So we've got our home ARP qualifying documents. We've got to make sure that they are a qualified population under the home ARP program. So they said that they are homeless, and then they are residing in a private or publicly operated emergency shelter, and they were referred by the provider, and you can see that provider letter there. So for those of you that have this is kind of just a quick what you would be looking for. And this home ARP qualifying documentation is available at that home ARP link. It is a large packet, and there's certain pages that you need as the housing provider, and then there are certain pages that your household would complete the information on. So we know here that they qualify as a qualified population under Home ARP because they were homeless and they've been referred by a homeless provider. So now we've got to document the income. So this is step 2. The first type of income is Social Security. And I'm going to give you guys just a moment to work the math. Based on some feedback from last week, I've adjusted how this is going to work this week. So I'll give you guys just a moment, and then I'm going to launch the poll to see what you guys get for the total. And then we'll go through the totals. So make a note of what you think his total is. And then we'll go through it with our answers slide. So it looks like we've got a $200 payment. All right, I'm going to go ahead and launch this poll. All right, I'm going to go ahead and end this poll. Thank you to everybody that responded. If you were one of the ones, your two options were 24,000 and 2,400. So it's going to be the 200 times 12 to get the answer that's appropriate. The next type of income is the employment verification for Mary. We sent this to the HR person. Carolyn sent it back to us. We've got our email saved there. We can see that Mary makes $19 an hour, 40 hours a week. There's an overtime rate listed. And then looks like they've passed their 12-month date and are now considered a full-time regular employee. I'll give you guys just a moment to calculate that income, and then I will launch the poll. All right, if you've got your calculation done and are ready for the poll, if you want to throw a thumbs up in there. All right, perfect. I'm going to go ahead and launch this. All right, it looks like our responses have slowed down, so I'm going to go ahead and end this poll. So the way to calculate that would have been the 19 times 40 hours. And then if there were any bonuses or anything, those would have needed to have been added in. Looks like we had a clarification because the employer didn't say how often she was paid. The clarification is in your whole package that you received, but it does clarify that the 19 is an hourly wage and not monthly or weekly. That's all of the calculations we would have had for income for this household. So now we had to verify our assets because we were doing the Home ARP program, and we know that requires asset verification by third party or firsthand documentation. So we can see here that the household has checking accounts and savings accounts. And then they also told us that they had a Cash App account with a zero balance and a Chime account with a zero balance. We're going to go back to the slide with the accounts holding a balance and have an interest rate on them. I'm going to give you guys just a moment to add up those non-necessary personal property items. Then I've got a poll to launch to kind of make sure we're on the right track. When you get your total added up, let me know. Give me a thumbs up. So if you're not sure what non-necessary means, then you're going to want to go back and watch those asset webinars because we go into detail about what necessary assets are and what non-necessary assets are. All right, I'm seeing lots of thumbs up, so we're going to launch this poll. What is the total non-necessary personal property for the household? All right. Looks like our voting has slowed down, so I'm going to go ahead and end this poll. And we're going to talk more about the assets. I promise we will work the math. So we can see here they've got two checking accounts totaling 120 and a savings account that's 90 with a 2% interest rate. None of our other assets had interest. So I'll give you guys just a moment to calculate the actual income from assets. And then I will launch the poll. Okay, seeing lots of thumbs up there. We've got to remember that actual income is always included. We just won't always have imputed income. Okay. In the interest of time, I'm going to go ahead and close this one. Looks like our voting has slowed down. And we will go through these, I promise. So we had our Cash App disclosed, but zero balance. So we did have a zero balance Cash App on our income certification. Chime, same thing, zero balance, but they disclosed it. Amy, before we talk about annualizing and we go through the answers of these things, are there any questions, or are the questions all about calculating these things?
I don't have any questions right now.
Perfect. Thank you. All
Welcome.
right, so let's look at this. We've documented everything. We've gone through our application. Now we've got to annualize it. So for William's Social Security, simple. We took the $200 a month times 12 months for an annual income of $2,400. For Mary's employment, we took the $19 per hour times 40 hours a week to get a weekly pay of $760 times 52 weeks gets us $39,520 annually. Added together, that totals $41,920 for the household's annual income before any adjustments are made. If you got that total, give me a thumbs up. If you didn't, and you have questions, put those in the questions box. All right, good. Lots of thumbs up. Thank you. All All right, so now let's look at the household's assets. We had William's checking account with $100 in it, no interest, so no actual income. We had their joint savings account with $90 in it and 2% interest for an actual income of $1.80. Then we had Mary's checking account of $20 with zero interest for no actual income. And then Cash App and Chime accounts that were zero balances and zero interest, so no actual income from those. Total non-necessary personal property is $210. Actual income from assets is $1.80, and that will be included in the household's total income. There was no real property for this household, so we didn't have to go any further. Imputed income is not required since net family assets are less than the threshold. And all of these had a discernible rate of return. We could find out that they were the interest rates or lack thereof on there. And while the household did tell us about that $3,600 tax return, their net family assets are effectively zero for purposes of eligibility. So to deduct $3,600 from zero, we still have zero. So there was no real necessity in doing that. But it's not wrong if you did do that. We just don't work in negative numbers. So we want to be sure we're not including negative numbers on the income certifications. So now it's time to talk about adjusted income. I made that household super simple because this is the harder part for today, and this is why you all came, hopefully. So now we're on step 4. We've got their annual income. Now we have to adjust it if they're eligible for the deductions. So the first deduction we need to look at is the dependent deduction. And this is a dependent deduction of $480 per eligible dependent in the family. Dependents are defined as family members who are not the head, spouse, co-head, and who are under 18 years of age, a person with disabilities at any age, a full-time student 18 years of age or older, and the full-time student status is defined by the school, not by the student or by you. So be sure you're getting a verification of the student status. To qualify for the deduction, verification of the disability or student status is required. A foster child, foster adult, unborn child, a child that has not yet joined the household, or the dependent of a live-in aid will never qualify for this deduction. A family does not have to have legal custody of a dependent to receive the deduction. However, the dependent has to live in the unit. A family may not receive a double dependent deduction for one member. So if there's a 19-year-old disabled full-time student, they are still going to get one deduction for the dependent, not one for each of the qualifying factors. So is the Russell household eligible for a dependent deduction? We can see that they have a household member under the age of 18. They also have somebody who has disabilities, but William is our head of household. And Jerome is a full-time student, but Jerome's also under the age of 18. So I'm going to launch the poll to see if you guys think they're eligible for this deduction. Simple yes or no. All right, let's see if we can get to 50% voted. We're at 36% now. So if you haven't voted, click over and give me a yes or no. Is our Russell household eligible for a dependent deduction? Leave it open for a few more seconds. All right, we didn't quite get to 50%, but in the interest of time, I'm going to close it. Most of you, we almost got to 50%, 49. Most of you said yes, that is correct. How much is the dependent deduction? I'm going to launch the next poll. All right. Got a few more people answering right now. Leave it open. All right, I'm going to go ahead and close this one. Almost all of you agree that this is 480, which is correct. There's one dependent, so they get one dependent deduction. The child care deduction is the next piece of the puzzle that we've got to look at. This is available for anticipated expenses to any family paying for child care. The deduction is available to all children under the age of 13 living in the unit, but not foster children unless the household can show that they're responsible for the child care for the foster persons and not the welfare agency that's paying for the foster care. This has to enable somebody in the household to work, look for work, or go to school. The family has to evidence that there's no adult family member capable of providing care during the hours care is needed. Child care expenses cannot be reimbursed by an outside agency or individual. And child care expenses deducted must be reasonable. They cannot be paid to someone living in the unit. They cannot exceed the work income generated by the family member during the period which care is provided. The child care expenses are not restricted when seeking employment or attending school. To document anticipated child care expenses, the family must identify the children who will be cared for, identify the family member who's enabled to work, look for work, and or go to school because of the child care, evidence that no other household member in the unit is available to care for the child, identify the child care provider, and provide documentation of cost. So we've got this in our household file. We can see that Jerome goes to daycare or has after school care, and that allows Mary to work. Nobody else in the household is capable of providing care. So we are going to move forward to make the decision of whether or not this household is eligible for the child care deduction. I'm going to launch the poll to see what you guys think. All right, I'm going to go ahead and end this poll. It looks like our voting has slowed down. Almost all of you said yes, which is correct. And we know that Jerome goes to childcare from 3 to 6 each day, and the cost is $15 per hour. We may have had to call the school to verify that, or we did some extra math, but I put that little note in there for you. So now we've got to calculate the deduction. First, we've got to determine Mary's annual income. We already did that. It's $39,520. Mary makes $19 an hour, working 5 days a week. The care is provided for 3 hours a day, 52 weeks in a year. The earned income during that time is $14,820. And that's Mary's income earned while her child attends childcare. The child care expenses are $15 an hour, 5 days a week, 3 hours a day, 52 weeks in a year, which is the $7,800 total expense. That is less than Mary's earned income, so that is an allowable deduction. That $7,800 will be an allowable deduction for this household. Are there any questions before we talk about the next deduction?
Nothing so far.
Okay. So the next deduction that we're going to talk about is attendant care and auxiliary apparatus expense deduction. That's a mouthful. This is available for unreimbursed anticipated costs for attendant care and or an auxiliary apparatus. The care or apparatus has to enable a family member 18 years of age or older to work, including the disabled member. The amount claimed is the difference in total expenses for attendant care and or auxiliary apparatus that exceeds 10% of annual income and earned income of the adult family member enabled to work by the attendant care or auxiliary apparatus. There is a hardship exemption in here if somebody was receiving the deduction in 2023. That hardship process could have started in 2024, and you can see that outlined there, but they would have had to be receiving this deduction in 2023. So if you have a home household that was over the 80% limit and you were having to do adjusted income in 23 and had to continue in 2024, you could have stair-stepped them from that 3% that was before HOTMA to the 10% deduction that is now. 811 folks, we're not sure if you're going to be able to use the hardship, but the 10% will go into effect in 2026. If the disability assistance enables more than one family member to be employed, the allowance cannot exceed the combined income of both. This includes items that are directly related to permitting the disabled person to work or other family member to work. This can include things like a wheelchair, ramp, adaptations to vehicles. Those would be one-time allowances. Cost of maintenance and upkeep of an auxiliary apparatus, like veterinarian and food costs for a service animal. Attendant care also includes, but is not limited to, reasonable expenses for home medical care, nursing services, interpreters for hearing impaired persons, and readers for persons with visual impairments. That list is not exhaustive. Those are just some examples you might see. So we can see here from our screening tool that we do have a household member that is paying for an auxiliary apparatus or an attendant care, and that's William. This enables Mary to be able to go to work, and the expenses are not reimbursed. We can see here that Michelle Crawford is the care coordinator, and they have issued a letter that says they are going to be honored to continue to provide medical aid service from 12 to 6 each day, and that it's going to be $450 per week. Is the Russell household eligible for the attendant care and auxiliary apparatus expense deduction? I'm going to launch that poll. And we don't need to think about what is William's disability, why do they only need it for this? We're not going to dig into that. We've got our paperwork. We're going to take it at face value for this example especially. But generally, you're going to have all the backup that you would need as well. And you don't need to know what somebody's disability is. But if they have the letter from the doctor, and we're going to assume William does, that says they need a care attendant, whether that's a live-in care or just a short time during the day, you're gonna accept those if they're valid and the integrity can be tested.
Kara, we do have a
Yes.
question about the child care expense calculation. So when
Okay.
you get done with the poll and done with this one, if you want to go back, just let me know and I'll pull it up.
I can do that. Thank you. All right. I'm going to go ahead and end this poll in the interest of time. Yes, Mary is able to work while someone provides care to William. The caregiver is paid. So let's finish this deduction and then we'll go back and look at that child care deduction. So first we have to determine 10% of the household's income. So the household's total annual income was $41,921.80 times 10% gives us $4,192.18. That is a disallowed amount. The government says that 10% is a reasonable amount to spend on medical expenses. So we take the disability expense of the 450 times 52 is 23,400 minus that disallowed amount to get an allowable deduction of 19,207.82, and that is less than the annual income. So this deduction is allowed. So this would be an applicable deduction for the household. All right, I'm going to go back to the child care. Amy, I've got that pulled up with if you
Okay,
have the question.
the question is their calculation for childcare expenses was 11,700, which they got by dialing $15 an hour or $15 an hour times 3 hours times 5 days times 52.
You're right. I didn't change that. It's 11,700. You are correct.
Thank you.
Thank you for catching that. I tried to check all the math. I always miss one though.
And then can transportation expenses to to the healthcare and back home be deducted?
I'm going to say no because the auxiliary apparatus and attendant care deduction has to enable someone to work. So if they were part of a bigger service that was caring for somebody or that was offering care while somebody worked, then or maybe somebody had a job that they couldn't take off, but it would have to enable somebody to work. So kind of the knee-jerk answer is going to be no, that's probably not going to fall into this category. But I would have to expand. I would have to know a little bit more about it before I could say for sure yes or no. Are we good to proceed?
Yes, that's all caught up.
Okay. So the next deduction is the elderly or disabled household deduction. And this is different than the dependent deduction. This is a household deduction, not a person per person deduction. And right now, this is $525 per house qualified household. For 811, though, this is still 400 until HOTMA is implemented, which right now is going to be January of 2026. This deduction is available to a family if the head, spouse, co-head, or sole member is at least 62 years of age or older, or a person with disabilities. A household member is entitled to only one deduction, regardless of how many family members qualify as elderly or disabled. So, is our household eligible for this deduction? We can see on the screening tool that William is a person with disabilities. William gets supplemental Social Security income, which by definition means he's disabled. And he's marked yes on the special needs verification. So if we needed to, we could get a doctor's letter, but I think this file has enough to say that we can make this determination. So I'm going to launch the poll here to see if this household is eligible for the elderly or disabled deduction. fixing the other pieces that child care deduction would have impacted while y'all got that poll. Okay, I'm going to end the poll. Thank you guys for your patience on that. So, yes, they are eligible for the deduction, and that was what most of you said. How much is their deduction? And this might depend on what program you're operating. But we're going to assume it's for the home ARP program or the home program. All right, I'm going to go ahead and end this poll in the interest of time. So the household is going to be eligible for a $525 deduction. Now, because the household was eligible for the elderly and disabled household deduction, the whole household is eligible for the health and medical care expense deduction. You would still have to do the 10% calculation if you hadn't already. We've already satisfied that. A lot of households don't get that other medical deduction because it has to enable someone to work. And that's the hard part to meet for that, or the part that we don't see very often. So a lot of folks start with this one. So the 10% would have to be met if it wasn't already fully satisfied with that other deduction. If the household is eligible, you will include the unreimbursed anticipated medical expenses of all family members, including non-elderly and dependent children, but not foster persons or live-in aides. Medical expenses include medically necessary apparatus, services, and medications. So this would be where your transportation, if you needed special transportation to and from the doctor's office, would go. You will include ongoing expenses paid in the last 12 months to project the upcoming year's expenses. Ongoing payments towards existing unpaid medical bills are eligible for inclusion for the upcoming year, but you must only include the amount of the payments to be made, not the balance due. Some examples of eligible medical expenses are the services of doctors and healthcare professionals, services of healthcare facilities, medical insurance premiums or the cost of an HMO, prescription or non-prescription medicines that have been prescribed by a physician, dental expenses, eyeglasses, or hearing aids. So we've got some information from our household. Since the household is eligible for the elderly or disabled deduction, they also get this deduction. How much are they going to get? We can see there's some copays and some prescription costs. We've got our letters here to show that they spent $600 at the clinic for copays, lab fees, and expenses. And then they anticipate prescription costs based on prior years to be $1,650. So I'll let you guys look at that for just a second. And then I will launch the poll. If you're ready for me to launch the poll, you can throw a thumbs up in there. All right, I'm going to go ahead and launch this. How much is their deduction? All right, I'm going to go ahead and end this one. That was our last poll. So no more of that. We can combine the prescriptions and the doctor's visits for a total deduction of $2,250. Now let's look at all the deductions together, unless there are questions we need to answer before that, Amy.
Nope, we're clear.
Okay. So now we've got our dependent deduction for Jerome of $480. Our child care expense deduction for $11,700. Thank you to whomever caught that. The attendant care and auxiliary apparatus expense deduction was the $23,400 minus 10% of household income for a total deduction of $19,207.82. Elderly or disabled family deduction of $525. Health and medical care expense deduction of $22.50. Because we'd already met that 10%, we were able to use all of that. Household income before deductions was $41,920.80 minus the total amount for the deductions, which with that child care update, it came out to $34,162.82. So now the household's adjusted income is $7,758.98. And we've got to calculate rent. So to calculate rent, we need to take the adjusted income divided by 12 months to get the monthly adjusted income times 30% to get the monthly gross rent. And then we've got to deduct our utility allowance. So our income, our adjusted income of $7,758.98 divided by 12 months gets us $646.58 monthly adjusted income times 30% gets us $193.97 minus the $52 utility allowance, which is fabricated, but we're going to go with that, gets us a total rent of $141.97. You would probably charge $141. You can't add the 3 pennies to go up, but you can take away the 97 cents to go down. So their rent would be $141 per month based on their adjusted income. Are there any questions before we go forward? I know you guys may be writing this down, taking notes.
Nothing right now.
Okay. So just a note about the medical expense deductions. If the family is eligible for both the attendant care and auxiliary apparatus deduction and the health and medical care deduction, the following has to be considered. You will only do the 10% test once. You have to calculate the attendant care and auxiliary apparatus deduction first, then the health and medical care expense deduction. The attendant care and auxiliary apparatus expense deduction is limited by the amount earned by the person enabled to work. Expenses cannot be included in both categories, so no double dipping. So if they had not been eligible for the attendant care deduction because maybe Mary could work regardless of whether William had care, then that attendant care could have gone into the health and medical care deduction. So the household was going to get it no matter what. Just for this one, a matter of where it fell. There is some overlap in what can be included, but if it's included in one category, it can't also be included in the other one. So now we've got to fill in our certification. We've done the application, we've documented everything, we've annualized our income, we've adjusted the income. Now we've got to put it together. In your handouts, there was a blank certification with just the household member information completed. If you were filling in your stuff, I would anticipate it to look like this. We've got our $2,400 in Social Security for William listed there in part 3. And then Mary's employment income for a total of $41,920. Then we've got our checking, savings, second checking, chime account, and cash app. They totaled $210. So in box L, you could either have a 0 or $210. And that would be correct either way. The actual income was $1.80. Only one of the assets had an interest rate. Everybody else had 0. So that gets added in. So our total household income is $41,921.80. We can see there that they are a 50% household. Home ARP LURAs, or land use restriction agreements, are going to detail how your households have to be qualified. So you're going to want to be sure that you are outlining that and really understanding, where they have to fall. And then we've got our designations marked. If you're still using an older version of the income certification that does not have the designations on page 1, I would encourage you to get the new one and begin using that or have that implemented through your operating system. Does the household qualify? Yes, we can see that they've got an annual income of $41,921.80, and their income is under the limit of $60,250 with a low home rent of $1,506. But because this is a home ARP population, we are going to have the rent based on their adjusted income. So this presentation qualified a household as a qualified population household in Austin, Texas under the Home ARP program. We're assuming this property requires households to be qualified population or QP and have income less than 50% with rents based on 30% of the household's adjusted income. Different programs have different eligibility requirements. You want to calculate the income as we discussed in sessions 1 through 7 of the 2025 Lunch and Learn series. The 8th session of the series calculated household income and assets for a household without adjusted income. This webinar is intended to be a resource after weeks 1 through 8 have been reviewed and understood. This should not have been the first webinar reviewed. If it was, you may have been a little bit lost because the background information was in those previous webinars. Different programs have different forms. The forms used in this presentation are for the multifamily programs operated or monitored by the department and the home ARP program. Some programs have required forms in addition to what was seen here. Sometimes your ownership or your management group has a different or has additional required forms. So you want to be sure that you're including those as well. When qualifying households for programs other than those monitored by the department, you want to check with your program administrator to ensure compliance. Here is a cheat sheet. Now that you kind of have a background for each of the deductions, this cheat sheet will make more sense. Without that background, it won't make sense. But you can see it's got the dependent deduction of $480. The child care kind of notes about the earned income has to be higher than the child care expenses. The attendant care and auxiliary apparatus has the 10% note. Excuse me, goodness. And then the elderly and disabled deduction of $525. And then health and medical care, kind of a note about that 10% test if it wasn't already satisfied. And then over on the right outside of a box, you will see that it kind of reminds you that if they're qualified for both the attendant care and the health and medical, they have to be calculated in a certain order, and they have to be added together. But you would only do the 10% test once, so you don't have to rush through that and do that twice. Please remember that you do have to give a notice of a rent increase, and for certain programs, you cannot increase the rent other than at lease renewal. For all of our programs, you can only increase the rent once during 12 months. And for all of our programs, if the rent is going to go up $75 or more, you have to send a 75-day notice. Some tips to minimize challenges. You want to make sure that all certifications and verifications are completed in their entirety. Make sure all household income and assets are certified and verified, and that includes the information with regards to adjusted income. All verifications or certifications are current. All forms are tested for integrity, and clarifications are present when needed. Make sure there's no correction, fluid whiteout, or evidence of tampering or perfecting. Go through a peer review process. And then if you have a third party or compliance team, don't look at them as a difficult step. They are a helpful step that helps build the strength of your tenant file. HUD has announced the inflationary changes that will be in effect for certifications with 2025 dates. They have now also announced those for 2026. So if I can put that link in the chat as well. The amounts are going to change for 2026, but they will not go into effect until you are doing certifications for 2026. So right now, while you're working on 2025 qualifying and stuff, you would not change that, but the amounts are going to change for 2026 certifications. Those are going to impact the dependent deduction. It's going to impact what amount is excluded for full-time students, dependents that work full-time. They're going to have the rule of 480 is now going to be a different amount. The passbook savings rate is going to decrease a little bit. The elderly and disabled deduction is going to go up. The asset threshold is going to go up. So you may want to take a look at those as well. We will update our chart when the COLA is announced. As of right now, the COLA has not been announced. I do not have a super secret doorway to Social Security to know when that's going to be announced, but I would anticipate it in early October, and then we will get this chart updated and posted to our forms website. I did just put the inflationary adjustments link in the chat if that's something you want to look at to be prepared for 2026. And that's all I have for our prepared presentation. I apologize for having that child care calculation wrong. If there are questions, we can go over that. Amy or Justin, if there's anything I did not go over in depth enough or anything I missed, we can jump into that now.
I can just say for 811 that, like Kara said earlier, that the HOTMA changes does not go into effect for 811 until January 1st of 2026. And so once January 1st of 2026 rolls, you'll be doing the adjustments just like Kara indicated. The only difference is that calculating tenant rent is slightly different. Tenant rent for 811 is the greater of 10% of annual income or 30% of adjusted income, and Home ARP only does the 30% of adjusted income. So those are the only two things I had that were different for 811. Thank you, Kara. This was a great presentation.
Thank you, Justin.
There's no questions, and I didn't have anything. Oh, wait, somebody has a question for Justin. Can you tell us what is the rent review for Section 811?
Yeah, so we are currently for our fiscal year 2026, which starts September 1st of 2025, We are doing rent reviews in the first quarter of that fiscal year to see if we're going to establish that process going forward. Currently, we are conducting the 811 monitoring reviews separately from the other programs, but in the first quarter, we're trying a new process where for the 811 program, we are splitting what we are reviewing in half. So eligibility and forms would be done at the same time as your other programs monitored during that period. And a rent review would be just a review of the rent and fees that are calculated during the period of scope that your rent review is covering. So a rent review is a focus of just your rents and fees. So if you receive that for September, then you're going to be part of that process in that first quarter. And if everything goes as expected, we would announce that to the entire portfolio that that's the process going forward.
Thank you, Justin. And if you have any questions about that, please feel free to reach out to the monitor who notified you, myself, or Justin. Kara, can you repeat the number of days the rent increase notices should be sent for all programs?
So the rule requires that if you've got a rent increase of $75 or more, then it needs to be a 75-day notice of the increase. The MFDL or Multifamily Direct Loan Program requirements are that you give at least a 30-day notice of rent increase. I think that's probably a good standard. I am not qualified or equipped to speak on what the property code requires as far as rent increases, so that would be something you'd want to check with your property attorneys on.
That's all the questions we have for now.
All right. Well, if there are no other questions, I see we've lost a few folks. When you log out, you will be prompted to complete a survey. I appreciate any and all responses, constructive criticism, accolades. If you did not enjoy this, please let me know that and why, and I'll work on ways to improve future trainings. The survey responses I usually email you back tomorrow or early next week. I appreciate all of those, and I appreciate you guys spending your lunch hour with us. We will go ahead and end this Lunch and Learn, our final series offering, and we will see you guys next time. Thanks, everybody. Have a great day.
Bye.